turn our attention to Merck Life Sciences, which has launched the MLab Collaboration Center in Bengaluru. And we're very pleased to have Daniel Stam, Executive Vice President, Process Solutions at Merck Life Science, talk to us about the MLab Collaboration Centers. I spoke to him a few days ago, and I began by asking him to describe the Collaboration Center.
Thank you very much. Yes, it is indeed an exciting day for us. This Collaboration Center is a place where, as it already says, where we as a supplier, with our expertise, meet our customers, their engineers, their scientists, and we collaborate to make the products work to their optimum. So customers come here to learn, customers come here to explore, and customers come here also to improve existing processes, existing know-how, to get it to the next level required for the biotech industry here in India, and in particular in this hub of biotech in Bengaluru.
And I'll come to India and Bengaluru in a moment, but give me an example of the kind of work that you're doing in existing collaboration centers around the world. Okay, I think we have a problem with that link. I was asking Daniel Stam of Merck Life Science, which has just launched an MLab Collaboration Center in Bengaluru, about, the strategy and the approach behind such collaboration centers. And, he was addressing the fact that it's a place where Merck Life Sciences can work closely with customers. But again, Mr. Stam, if you could just explain to me and describe to me the kind of work that you're doing in collaboration centers around the world.
Yeah, indeed, we have a network of 10 of them around the world. Bangalore is one of them. They are all at the same, similar standards. I give you one example. We train around the world, applying the same protocols and content, operators to become certified in aseptic processing, which means they are certified and qualified to handle drugs that need to be sterile because they're going to be injected in patients. So what customers do, they come to us, bring a team of people, and we train them on the systems, on the products, on the instruments that they use in their fabrication, in their plant. They get trained, and then they can go back and train others and apply the expertise in their home company, so to say. But what we also do is customers come with us with a problem. They might have a problem in what technology should we choose for a scale-up of a process. They have discovered a molecule, and now they want to scale it up to pilot and manufacturing. This is where, in fact, most of the work is happening. What surface, what dimension should I choose? How do I run? What are the process conditions to run those products properly, to get the right recovery and the final product as it is supposed to be? This collaboration happens in this center, and only when customers then go back and apply it in their plant, they realize the value of this collaboration.
Which brings me to Bengaluru. And why has Merck chosen to launch the MLab in India at this stage?
You might know from the history that Merck Life Science is a true expanded offering from Legacy Millipore, Legacy Sigma, Merck Chemicals. This is all under one roof now, and we have indeed the broadest and deepest portfolio in the industry that we can offer to biomanufacturing customers. So it was about time for us to shape up and lift that MLab, which before just existed as a training facility, to lift it to that MLab level where we truly cover the full portfolio with all the capabilities we have, and also bring that message into the market, because we are much more than a chemicals company, we are much more than a filter company, we are indeed a solution provider for the emerging biotechs here in the area. And you asked earlier on why in Bengaluru. We have already a very well-established base here, and Bangalore is the largest biotech hub in India. So I think it's a good place to be. We have smaller labs in 2 other places, but Bangalore is really the center of gravity for us here in India in that respect.
So, you know, just to bring the point further home, what are the kind of biopharmaceutical companies that you hope to collaborate with at this center?
I wouldn't name the companies because, fair enough, with many of the clients that work with us here, we sign non-disclosure agreements. So what I can assure you is that any large biotech, any emerging biotech in India, in the Bangalore area, but even across the country, is a candidate to use our collaboration here, our collaboration centers. And the well-known ones, I wouldn't be aware of a single one that hasn't done work with us here in this center. So assume that those active in biotech and biopharm, they would also collaborate with us.
And how many out of the total could be startups? Is it possible to express it in percentage terms?
Let me answer it this way. There is a range of big established biotechs in India, and they work with us on improving yield, optimizing process steps, optimizing the economy of a process. They work with us, and then we have a program that we call driving emerging biotechs, supporting emerging biotechs. This is where all the smaller ones would fall. Some of them even at the state where they don't have a facility yet to manufacture, but they are evaluating technologies to bring their drug candidate to market. So these are engaged very early on with us as well, as typically through an MLab collaboration. I couldn't give you an exact percentage on this, but I would say we have almost equal activity and intensity of small upcoming companies joining us here, as well as the bigger established companies.
Okay, I'm not an expert on Indian pharma and biopharma companies, but they do seem to be under a fair bit of US FDA scrutiny. The question I'm asking you is, would collaborating at your MLab centers help Indian companies meet the US FDA requirements better?
The answer to your question is an absolute and clear yes. And let me explain the logic. We apply in this MLab the very same practices. We use the same products. We use the same specifications, the standards of protocol, the operating procedures as anywhere else in the world. So if customers engage with us, this is also an engagement to enable them to be at the level of requirements that the current regulatory environment needs. So we don't make a difference and go for any different standards here, and customers collaborating with that with us benefit from that global standard that we can bring to India through our global network.
Okay, let me ask you a slightly broader question. I mean, what do you make of the US FDA scrutiny and the observations of Indian companies? The frequency seems to be rising.
I think my answer would almost be a similar one to your previous question. All we can do as a supplier of technology, expertise and services to biomanufacturing clients is to give them assurance, to give them compliance, to give them the proper protocols, and if they are willing to engage, train them on appropriate and well-trained operating, and then we have to leave it to the customers in India how they deal with the challenges you just described. We are an enabler for the industry. We are not, and I think we have a role to play there, absolutely, but it's absolutely not for me to judge or give an opinion on the ability of Indian companies to reach those regulatory levels.
Fair enough. I just wanted your thoughts about the Indian regulatory oversight and whether or not there's anything unique about that.
I would again answer similar. We really apply the global standards. Of course, we are watching together with our customers specific needs of the Indian regulations and would together strive to comply with those. But assume that in particular in the space of biotech, biosimilars, there is not much room for applying different standards, because what we also see is that the Indian customers want to produce for the world and not for India only. So in fact, we have no space here for, or no tolerance for different tiering.
The MLab Collaboration Center in Bengaluru, how fast do you see that scaling up?
I would say I will give an answer here in terms of, think of it as an organic growing unit, growing with the industry, growing with our business. You can get numbers about the growth of the biopharmaceutical industry somewhere in the high single digit. In some areas it's higher. We grow at the pace of the industry. Our ambition is to grow a little bit higher. And with that, we grow our operations, our number of employees and so on. So apply a general rule to this rather than, we don't do step investments. We do it on an ongoing base to be able to respond to the needs of the customers on time.
And how does this collaboration center in Bengaluru fit into the larger Merck presence in India?
The larger footprint of Merck in India, I'm sure you are quite familiar with. We have several thousand employees, but I would want to bring the attention to the event of today, to the business we are representing here, which is process solutions, providing technology, expertise, and products to manufacturing customers, the GMP manufacturing customers. And in that respect, this unit is from a pure size of number of employees, is not so big, but from the impact it has for enabling a lot of customers in India to use Merck technology in the appropriate way, it has quite a catalytic effect on the efficiency of this go-to-market model.
Dr. Patankar of Syngene was the chief guest at the launch of the center when it happened a few days ago. Should we read anything into it?
Absolutely not. There's no specific, don't read any specifics into this. He's one of many customers who has worked with us over the years, and we wanted to pick one, but there is no exclusivity. This center is open for everyone, and we would love to have many customers like him engaging with his teams, engaging with his development labs and so on, to join us and collaborate. So don't read anything more into this than, I think it's an honor for him, it's an honor for us, but hopefully others will enjoy the same experience that he and his team experience with us in this center.
Daniel Stamm, Executive Vice President, Process Solutions at Merck Life Science, many thanks for joining us. I mean, the opening of the MLab Collaboration Center, particularly relevant at a time when US FDA scrutiny of Indian pharma companies has, well, at least the frequency of scrutiny has gone up, the frequency of observations has gone up. So great to get your insights on this. Thank you for your time on NDTV.
Thank you very much. Bye-bye.
Time for a quick break. When we return, we're going to take stock of all the news flow that's come through today at a company level. And yes, pharma is going to dominate that list once again. Catch the updates after the break.